Today marks the World Mental Health Day. Every year, people use the 10th of October to raise awareness about mental illness and advocate against a social stigma. This year's theme focuses on young people's mental health in a changing world. Experts say half of all mental illnesses can be diagnosed when the patient is a teenager. However, most cases go undetected and untreated. To cope with the challenges of a fast-paced, evolving world, young people need to build up resilience from an early age. The World Health Organization has cited internet addiction as one of the factors fueling mental health disorders. Well, let's explore this topic now with clinical psychologist Lincoln Khasakhala in studio with me. Dr. Khasakhala, thank you for joining us on the program. Let's start with how mental health wellness is being portrayed. What is your assessment of the way it is being portrayed? And as health professionals, are you making any headways in awareness raising programs?
The way it is portrayed, actually, like in Kenya, is one, it is overemphasized. Then the other thing we notice is that we distort what mental health issues are, and then the other thing we note, as you mentioned, we stigmatize people with mental illness, and then we discriminate them in all sphere of life. So that causes the people who are sick actually to come forward for treatment, even though if the treatment are available.
Let's look at Kenya as an example and make it a little bit more practical, though. What would be the mental state, for example, of a Kenyan couple, a married couple, struggling to make ends meet, for instance, in this with the high cost of living currently prevailing in Kenya? And what would your advice be for people who cannot afford access to public facilities or medical health?
I think one of the WHO slogan is that there's no health without mental health. So looking at that, we say that mental health issues in the country, particularly people suffering from them, are actually lagging behind. And if we notice that most of the disorders in our setting, we diagnose them much later in life, when somebody actually has suffered for more than 10 years. And you notice that the impact on the person who is suffering is quite severe, because one, they've been discriminated, they cannot work. Then the other thing is that if it is our setting, we notice that our culture, one cannot marry somebody who is mentally ill. So you notice that for a young couple, when you make a diagnosis of mental disorder, and if they're young, actually, we are asking that this couple to separate. And in our setting, we know that if a man is mentally sick, it is expected that the wife will take care of the person. But when you look the other way around, that if a wife is mentally sick, then the main culture is that we don't have somebody with mental illness in our family. And therefore, it is meaning that this lady is getting back to her original home. So it causes a lot of friction and, I'll say, divorce that makes the mental illness worse.
Right, Lincoln Khasakhala, thank you very much for your insight on mental health disorders in Kenya.